Now what Hahnemann has to say, Hahnemann, he discovered or he found homeopathy 200 years ago, that is in 18th century. Now psychotherapy and whatever, the classification, all these are happening from the 19th century, right? But whatever Dr. Hahnemann has written about management of homeopathy, management of mental disease according to homeopathic principles is in the 18th century. So let us see what he says about that. So Samuel Hahnemann, he was one of the first physicians to see mentally ill patients as sick individuals requiring empathy and proper medical care. During his times, uh, patient who was mentally ill was seen as a person who is being cursed by God, or who is being cursed by a bad omen, and he used to be deprived from living in the normal society. He used to be thrown out of the society. He used to be, not asylum, but he used to be thrown out. And people would not see them, visit them, right? So during that time, he was the first person who said that yes, mentally ill patients also require empathy and proper medical care. So for them, he started making the principle how we can manage such cases. According to Samuel Hahnemann, for any disease for that matter, when we are, as a homeopath, we are treating any disease, we always consider that mind and body as one entity. So also in mental disorders. So according to Samuel Hahnemann, mind and body are not separate entity. They are an indivisible whole. And illness is a result of biological as well as physiological and psychological events. Okay, so what Dr. Hahnemann says here is, well, rather than reading, I would want to explain this. Here, what he tries to say is that when a person becomes ill, that is when a natural disease attacks any human being, so it will find its place, or it will go and settle either on the body or on the mind. So whatever we see nowadays, the respiratory symptoms or the GIT symptoms, so here the disease is settling on some organs or one or some part of the body. So any part of the body affected, the mind is always affected. That is what he wants to say, that always the physical disease is always there with changes in the mental plane. Or it could happen that in extreme cases where the seat of action of the disease could be purely on the physical side or could be purely on the mental side. That means you will get only physical symptoms in certain diseases, or you may get only mental symptoms and no physical concomitants in certain diseases. So these, he called them as one-sided diseases. So if you see, yeah, I'm explaining here the same thing. So disease can settle only on the physical body. Even if it is on the physical body, mind is always there. Okay. Or the disease can settle only on the physical body, or it can settle only on the mind. Okay. So according to his classification, this is the classification of all kind of diseases, chronic diseases, what Dr. Samuel Hahnemann gives. But if you see here, so it is a chronic disease. So mental disease is a chronic disease. It is a disease with very few symptoms. So he called it as a one-sided disease where the seat of action is on the mental plane. Okay. So according to him, all psychological disorders or all mental disorders are chronic diseases with only few symptoms, and it's a one-sided disease with only mental symptoms. Okay, so according to him, all mental disorders, the classification according to Hahnemann, he says that they are of four types. Okay, one is somatopsychic type. Aphorism is, for people who are non-homeopaths here, to tell them, aphorism, it's a section, or it's a book where we have different sections for with principles of homeopathy, where the directions are given how we can treat the disease. So aphorism is nothing but it's a section. So somatopsychic type, which is mentioned in aphorism 216, that is one type. Wherein in somatopsychic type, first the natural disease, it attacks on the corporeal body, that means on the physical body, and then the mind gets involved, or there will be disturbances later on the mind. So that is somatopsychic type. Or there can be disease where purely the mind is affected first, and then the symptoms on the body is appearing. So that is psychosomatic type, which you see in section, the management is given in section 225. And the next type is mental diseases due to exciting cause. Something, there is a triggering factor, maybe fright or whatever, some triggering factor is there, and the patient starts behaving very weirdly, gets anxiety, depression, whatever. So that he classifies under mental disease due to exciting causes. And the next type is mental disease of doubtful origin. Now, here we do not know whether the corporeal body was first affected or the mind was first affected. Okay, so that he calls as mental diseases of doubtful origin. Okay, now I will take through all these types of diseases by showing different cases.